Namaste. Hello everyone. I'm Dr. Barnali Das, consultant of Kaya Chikitsa Department, that is Medicine, Ibrahim Ali Ayurvedic Medical College and Wuhan Hospital, Meghalaya, USTM. Over the years, the most frequent complaint I have received while treating the patient is premature graying hair. Mainly those complaints are coming from the young fellows. That's why I'm bringing this video today to discuss about the premature graying hair, what is in the Ayurveda about premature graying hair, what are the main causes behind it, how we can prevent it, how it can be treated having the remedies through Ayurveda, and how the Ahar and Vihar affect it, that is diet and regime. Let's see. The main cause of premature graying hairs are genetic disorder, number 2 nutritional deficiency. What happens in nutritional deficiency? The cell of the hair follicles are rapidly dividing cells which requires increased DNA synthesis, and if some vitamins and minerals are deficiency like vitamin D, vitamin B12, biotin, and minerals like copper, zinc, iron, calcium, if deficiency is there, then it causes premature graying hair. Third, environmental factor like UV exposure, pollution, which damage our hairs and leads to premature graying hair. Then fourth is stress, which increase our cortisol level inside our body, and further it increase the free radicals inside our body. Free radicals like reactive oxygen spaces, free reactive nitrogen spaces. These are free radicals which increase in our body, and it leads to premature graying hair. Next is thyroid disorder. If your thyroid hormone is imbalanced, then it leads to premature graying hair. Smoking is the cause which leads to premature graying hair, and the chemical treatment which your most young generation are using is very bad for your hair. Please stop this. Chemical treatment of hair leads to premature graying hair. In Ayurveda, premature graying hair is called palitya, and it is mainly because of increase in pitta dosha. Three dosha is there, that is Vat, Pitta and Kaph. These three doshas are constitute in our body. Pitta dosha naturally increase inside our body with so many factors like Prakriti, what the Prakriti of the person is. If the Pitta Prakriti person is there, then automatically Pitta dosha is increases. Then age, in the middle age person or young age, Pitta dosha is increases naturally. Ritu, 6 Ritus are there. Among them, Sharad Ritu, that is autumn season, from mid-September to mid-November, automatically Pitta dosha is increased inside our body. And those person which having so much anger, so much irritated all the time, naturally Pitta dosha increases. When Pitta dosha aggravated, it further increase or aggravated our Rakta Dhatu, and it leads to Palitya Roga. Now the treatment part. How we can prevent it, how we can treat it, and what should we take when the premature graying hair occurring in you, that is Palitya Roga. In Ayurveda, the first line of treatment is Nidan Parivarjana. That means away from the cause. The cause which affect it, you have to away from it. Like genetic disorder, we cannot do much about it. Nutritional deficiency is one of the cause, so we have to evaluate it through investigation what deficiency is inside our body. If you have vitamin D, biotin, vitamin 12 deficiency is there, then you have to take it. Otherwise, in the form of medicine, or so many herbs are there, especially the fruits having so many vitamins are there, along with minerals like copper, iron, calcium and zinc. You have to take it. How you get away from the environmental factors like pollution, UV radiation. You can cover your hair with scarf and other clothes to get away from the pollution. Or weekly you have 2 or 3 times you wash your hair, so that oil which is produced naturally in our body, in our hair, should not be contact with dust and pollutes. Then comes to smoking, you have to avoid it. There is no other way, you have to avoid it to prevent the premature graying hair. Then thyroid hormone, if it is high or it is low, you have to level it out. You have to come to the hospital to treat it, to make it in a balanced way. The most common cause is stress. So you have to reduce it with the help of meditation, yoga, pranayam. From children, young, and the old age, having stress in your life every time, everywhere. But you have to overcome with the help of these things. Meditation, yoga, and pranayam should be included in your day-to-day lifestyle. Third treatment is Samsaman Chikitsa, that is medicine. For preventive measures, we are giving Rasayan therapy. So many Rasayan therapies are available in our hospital. So I welcome everyone to visit our hospital for Rasayan therapy. And so many medicines in Ayurveda is there for premature graying hair, that is Palitya Roga. But I can't say the particular medicine's name here because all persons having their own prakriti, and after examining the prakriti we are giving the medication. So you have to come to our OPD section and examine your prakriti, and then we are prescribing the medicine. And then come to Ahar and Vihar, that is diet and wisdom, what you should take and what we should not take. Apatya, that we should not take if you have premature graying hair, that is Palitya Roga. Excessive salt, some person are taking the raw salt. You should not take that if you have this problem. Instead of taking excess salt, then you can take Sandhav Lavan. If you are taking in the salad, you can use Sandhav Lavan instead of normal iodized salt. You have to avoid spicy food, junk foods which are having very spicy in nature, and then you have to avoid also excessive exercise, excessive exertion, excessive fasting. You have to avoid to decrease the pitta because it leads to increase of pitta dosha inside our body. Six types of ras is there, that is Madhur, Amla, Lavan, Katu, Tikka, Kasai. These six ras are affecting the doshas inside our body. Among them, Amla, Lavan, Katu, that is sour, salty, and pungent taste. You should avoid those having the food having these rasas. You should avoid these things. Now come to the part of pathya, what you should take in your diet. Few herbs are there which is available in your kitchen, in your market and nearby. That is amla, amlaki. It is a very good rasayan. You can take it in the form of powder, juice or murabba form. Then other herbs are like satavari, triphala, gulkand, raisin, black raisin. In Assamese it is called kismis. You can take the water, soak it the black raisin and take the water in the morning in the empty stomach. It is very good for your hair. Till for local application, you have to do Siro Abhyanga. It is in with Bringaraj oil, or you can apply simple coconut oil. That is, you have to take a cotton or a square size of cloth, cotton cloth, dip it in the oil and put it in your head for 5 to 10 minutes or 20 minutes you can take it. It is very effective in falling hair and also premature graying hair, that is palitero. Remember, prevention is better than cure. Before it's too late, you have to prevent from the disease by with the help of ahar bihar, diet and resume, pathya, what you should take, what you should not take. You have to keep it in mind and lead your life by preventing this disease. Thank you.